It's a really exciting time because we're about to launch the additional data. So we're starting to collect data in connective tissue diseases and vasculitis, and I think that's so important. The NEIAA is a perfect opportunity to take your department and yourself on a continuous improvement journey. You can see your data, you can compare your data both within your department, against other departments, against peers, against national standards, and you can take yourself on a continual improvement pathway. You look at the time it's taking you to see your patients, you can improve the time it takes you to see your patients. You look at the amount of data you collect and you can improve on that. And I think actually giving people personal ownership, saying this is your data, it's your job to collect your data. If you want it to be correct, you're going to do it yourself and you're going to do it well. So that's my passion, and I think extending it to other diseases is a great opportunity. We know that the way the data's changing, the data entry is changing, is going to reduce the amount of data we've got to put in. We're no longer going to have to put in patients who don't have a definite diagnosis, don't have early inflammatory arthritis. So that's going to take away about 60% of the work we've been doing till date. So we've got that extra time now on our hands to put in the data. And I'm passionate about Sjögren's, for instance, and for the first time we'll be building up a pattern of Sjögren's disease, new diagnosis across the UK. And we'll do the same for vasculitis disease and other connective tissue diseases. So I would view the changes as the next step in improving the audit. Moving it on from audit, most of us have moved on from audit to quality improvement, and actually that is the next logical step, that this is an opportunity for all of us.
So reducing the health inequalities that we have between rare and common conditions is a priority right across Europe. And that's why our government has the UK framework for rare diseases, and we all have a role to play in that. And one of the priorities we have is how can we use national data to reduce variation, improve standards of care and drive quality improvement across the rare rheumatic conditions. I co-lead the National Quality Improvement Programme for Rheumatology called Getting It Right First Time, and we're really aware of how the National Early Inflammatory Arthritis Audit data has really driven quality improvement for inflammatory arthritis. GIRFT has now developed key pathways for the other inflammatory conditions, so giant cell arteritis, other types of vasculitis, connective tissue disease, and that's why NHS England has changed the scope of the audit to include these rare rheumatic conditions. So from collecting data on new cases, we can use similar data to drive quality improvement across the range of all inflammatory rheumatic diseases. So given the overall really significant burden of data collection with the new audit, we think that including new cases of these rare conditions will have a really small impact on the burden of data collection, but will have a really significant impact on how we can improve care, reduce variation, and give us some data to drive the same quality improvements for these rare conditions as we've seen in the more common types of inflammatory arthritis. And at population level, the benefit will be that this will be, I think, the first national audit that will collect data on rare conditions. So again, another example of rheumatology leading the way in medicine in how we reduce some of those inequalities and improve care for people living with rare conditions. And it's a real opportunity for us all to engage in the new audit to do so.